X-rays are a powerful tool in modern medicine, allowing doctors to peer inside the human body and diagnose a wide variety of conditions without the need for invasive procedures. But whenever the subject of X-rays comes up, especially in the context of healthcare, it's natural to wonder, do X-rays have a negative impact on health? What risks are involved, and how do they compare to the benefits? To fully understand the impact of X-rays on health, it's important to begin with the basics of what X-rays are and how they work. X-rays are a form of electromagnetic radiation, similar to visible light but with much higher energy. When X-rays pass through matter, like the tissues of the human body, they are absorbed by denser materials, like bones, more than by softer tissues. This property is what makes X-ray imaging so effective for visualizing the structure of bones and detecting fractures, infections, or abnormalities. However, the same high energy that makes X-rays useful for imaging also means they can have biological effects on living tissue. X-rays are a type of ionizing radiation, which means they carry enough energy to remove tightly bound electrons from atoms, creating ions. This process can damage or alter the DNA within cells. If the DNA damage is not properly repaired, it can lead to mutations, and in some cases, increase the risk of cancer. The potential health impacts of X-rays are largely dependent on the dose of radiation received. In medical settings, the doses used for diagnostic imaging are typically very low. For example, a single chest X-ray delivers a dose of about 0.1 millisieverts, which is roughly equivalent to the amount of natural background radiation a person receives over 10 days just from the environment. More intensive imaging, like a computed tomography, CT scan, can deliver higher doses, but even these are carefully regulated and kept as low as possible. One of the most important concepts in understanding the risks of X-ray exposure is the principle known as ALARA, as low as reasonably achievable. This principle guides healthcare professionals in minimizing radiation exposure by using the lowest dose necessary to achieve a useful image, limiting the number of exposures, and shielding parts of the body that are not being imaged. Thanks to advances in technology, modern X-ray equipment uses much lower doses than in the past, and digital imaging often requires less exposure than older film-based methods. So, what are the actual risks associated with medical X-ray exposure? For most people, the risk is extremely low, especially when considering the benefits gained from accurate diagnosis and treatment. The risk of developing cancer from a single X-ray examination is minimal. For example, the increased risk from a chest X-ray is estimated to be about 1 in a million. To put that in perspective, the risk of developing cancer from natural background radiation over a lifetime is thousands of times higher. However, there are certain populations who are more sensitive to radiation, such as children and pregnant women. Children's bodies are still developing, and their cells divide more rapidly, making them more susceptible to the effects of ionizing radiation. For this reason, doctors are particularly careful when ordering X-rays for children and use alternative imaging methods, such as ultrasound or MRI, whenever possible. Pregnant women are also advised to avoid unnecessary X-rays, especially during the first trimester, when the developing fetus is most sensitive to radiation. It's also important to distinguish between diagnostic X-rays and therapeutic uses of X-rays, such as radiation therapy for cancer. Radiation therapy involves much higher doses of radiation, carefully targeted to destroy cancer cells. While effective for treating cancer, this higher exposure does carry a greater risk of side effects and potential long-term impacts, which are weighed against the benefits of treating a life-threatening disease. In addition to cancer, extremely high doses of X-ray radiation can cause other health effects, such as skin burns or radiation sickness. But these outcomes are exceedingly rare in medical imaging. Such effects would require doses far beyond what is used in diagnostic procedures, and are usually only seen in cases of accidental overexposure or industrial accidents. Despite these risks, the benefits of X-ray imaging in medicine are immense. X-rays have revolutionized the ability to detect broken bones, locate foreign objects, diagnose diseases like pneumonia, and even guide surgical procedures. Without X-ray technology, doctors would have to rely on less effective or more invasive methods, which could themselves carry greater risks. The perception of X-rays as dangerous often stems from a misunderstanding of the difference between medical use and other sources of radiation exposure, such as nuclear accidents or atomic bomb blasts. The doses used in medical imaging are thousands, sometimes millions, of times lower than those associated with such catastrophic events. Additionally, regulatory agencies such as the U.S. Food and Drug Administration, FDA, and international bodies like the International Atomic Energy Agency, IAEA, set strict standards for the use of X-rays in medicine, ensuring that equipment is safe and that exposure is minimized. It's also worth noting that people are exposed to small amounts of natural background radiation every day, from sources like the sun, soil, and even the food we eat. The typical annual dose from natural background radiation is about 3 millisieverts, while a dental X-ray delivers less than 0.01 millisieverts. In other words, the exposure from occasional medical X-rays is a tiny fraction of what most people already receive from their environment. Over the years, safety measures in medical imaging have improved dramatically. Lead aprons and shields are used to protect parts of the body not being imaged, and technologists are trained to position patients carefully to minimize exposure. Modern X-ray machines can often adjust the dose automatically, based on the patient's size and the area being examined, further reducing unnecessary exposure. Patients sometimes worry about the cumulative effect of multiple X-rays over time. While it's true that radiation dose is cumulative, meaning it adds up over a lifetime, the total exposure from routine medical imaging is still very low for most people. Doctors keep careful records of each patient's imaging history and make recommendations based on the medical necessity of the exam. In situations where multiple scans are needed, such as for chronic conditions or cancer follow-up, the benefits of closely monitoring the patient's health usually outweigh the small increase in radiation risk. For those who work with X-ray equipment, such as radiologists, technologists, and dentists, additional precautions are necessary to minimize occupational exposure. These professionals use protective barriers, monitoring badges, and strict protocols to ensure that their lifetime exposure remains well within safe limits. In summary, while X-rays are a form of ionizing radiation and do carry some risk, especially at high doses or with repeated exposure, the levels used in diagnostic medicine are very low and are managed carefully to protect patients' health. The risk of harm from a single medical X-ray is extremely small, especially when weighed against the significant benefits of accurate diagnosis and treatment. For most people, the advantages of X-ray imaging far outweigh the potential risks. The key to safe and effective use of X-rays in medicine is communication and informed decision-making. Patients should feel comfortable discussing any concerns they have with their healthcare providers. Doctors are trained to consider the risks and benefits of each test and to use alternative imaging methods when appropriate. If an X-ray is recommended, it's because the information gained is expected to have a meaningful impact on the patient's care. In the rare cases where X-ray exposure could pose a greater risk, such as for children, pregnant women, or individuals with a history of frequent imaging, doctors take extra precautions to limit exposure and explore alternatives. In all cases, the goal is to achieve the best possible outcome for the patient, using the safest and most effective tools available. Ultimately, X-rays have transformed medicine, making it possible to diagnose and treat illnesses that would otherwise go undetected. While it's wise to be aware of the potential risks, the evidence shows that, when used appropriately, X-ray imaging is a safe and invaluable part of modern healthcare. By following established guidelines and maintaining open communication between patients and providers, we can continue to benefit from this technology while keeping health risks to a minimum.